Here we go. Hi. Well, I'm Margaret Fire-Robin, serving on Bristol, Tennessee City Council, currently as mayor, and I welcome everyone and open this called City Council work session for May 12th, 2020. And first thing we do, Tara Music, can you please call the roll?
Fire-Robin.
Here.
King.
Here.
Powers.
Here.
Luttrell.
Here.
Turner.
Here.
All right. Mr. Sora, if you could introduce other staff and guests who are here with us today, that would be great. And you're muted.
Thank you. Yes, Mayor, we have several guests with us today. First, we have Gary Mays, Director of Sullivan County Regional Health Department, along with Dr. Stephen May, who's the Chief Medical Officer with the Health Department. We also have Steve Cyphers on board, Executive Director of Bristol Housing. Later this morning, Joel Conkin, who serves as attorney representing Bristol Housing, will be joining us. That's probably going to be in the neighborhood of 10 o'clock. Also on board, we have Tim Beavers, who will be presenting on building codes and international energy codes. We have Danielle Smith, City Attorney. We have Tara Music, our City Recorder and Finance Director. In addition, we have Terry Napier, Director of Parks and Recreation, and John Luttrell, Director of Community Relations. In addition to Shane Varney, who's orchestrating this entire concert.
Right. We can't forget that. Those are essential workers these days for everybody, the IT folks. Thank you very much. And the next thing we need to do, Danielle Smith, is to have a brief discussion about holding electronic meetings.
Yes, Mayor. We are holding this meeting electronically in accordance with the Governor's Executive Order number 16, which has been extended through June 30th to allow governing bodies to meet electronically versus physically in the same room, as long as the governing body believes that it's necessary for them to do so in order to protect the health, welfare, and safety of Tennesseans. And so as long as this governing body believes that it's necessary to hold this meeting electronically, it can continue to meet electronically. So at this point, I think it would be appropriate for each of the members to indicate whether they believe it's necessary to meet electronically in this fashion.
Okay, and is this an official vote or just go through and just people say yes?
That just if people can say yes or no, that would be.
Okay.
Yes.
Okay.
Yes.
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 Yes. Thank you very much. And I know this is a work session versus, actually we probably can't vote because this is work session. So it is consensus. So
There should still be consensus. It should still be reflected in the minutes.
Right.
So.
Yep. Thank you very much. Also, I'll just note that with these electronic meetings, I know yesterday evening, my internet connection was pretty unstable. So Vice Mayor Luttrell, if you can stand by if I have any issues that you can pick up and host our meeting. So appreciate your readiness to do that. Okay, Mr. Soar, do you want to start us off on our work session agenda? And we have several things. And
Yes, Mayor, as has been our practice in the recent weeks through the COVID-19 event, we've asked Gary Mays and Dr. Stephen May to participate and give us an update as to the status of the disease in Sullivan County and our community. So with that, Gary or Dr. May, whoever wants to lead this show off.
Okay, well, first of all, thank you, Bill, and thank you, Mayor Fire-Robin and the Bristol Council for inviting us. It's always a pleasure, believe me, to attend your meetings, and these are challenging times, and I appreciate and respect the council and the city of Bristol's interest in our pandemic and our situation in Sullivan County, particularly Bristol, Tennessee, and all the activities that's been going on. What seems like for years, but has only been a few weeks, actually. So we actually are doing well, shall I say, and that's a relative comparison in Sullivan County in the city of Bristol. And Dr. May can expand on this, but we currently have 3 active cases in Sullivan County, and we have 15 persons that we're actively monitoring. Monitoring means someone has been exposed or close contact to COVID-19 and they're being monitored for 14 days. We closely monitor them every day and keep up with their situation to minimize spread. And of course, should they become ill, we can help them seek medical attention and get the appropriate testing. Sullivan County received, I believe it was last week, 9,600 masks that was supplied by the state of Tennessee in Sullivan County. The city of Bristol picked up 2,000 of those masks. And I commend Bill Sora and the city staff for being very diligent and aggressive in getting those out to the citizens of Bristol. Our staff also is working with 5 churches to help us disseminate those masks. We're working with of course, we distribute them at the Blounteville Health Department, the Kingsport Health Department. Kingsport Transit System is also distributing masks for riders in case they need them. The UT Extension Office, which is located here in Blounteville, is helping us disseminate those in various programs throughout Sullivan County. We also are distributing those to the county school system staff, and we make that offer to Bristol, Tennessee school system staff as well. We're giving them out at our testing sites as we continue to test in Sullivan County. And we're also distributing masks at our feeding locations supported by the school system. We're giving those to the families that come and attend, and children, of course, as well. And that is our current active distribution. Our team is working with both cities and county offices to hopefully more penetration in the community and make sure the masks are available to those that want a mask. Changing topics, we have been working in our joint information communications team, and that consists of Bristol, Tennessee PR person, the Kingsport PR person, the Bristol and Kingsport Chambers of Commerce, and our own PR person, and working on a messaging plan for future actions. Reinforcing the safety and social distancing, particularly in the phase that we're in. We've solicited business participation throughout the county. It's been well received so far. I'll have to commend your own very own John Luttrell has been a key person in their beginning production on that messaging program, video program, social media and such. On the 13th of this week. And I want to thank Bill for being so gracious with the city staff and helping us put this together, because without that, we probably would not have the resources to do it. So very proud of our partnership with the city of Bristol and everything that Bristol's done. And I probably should pause at this point and kick it over to Dr. May. Yeah, there he is. And let him update you.
Okay, just to give you a data update, looking at our numbers, our death rate in Tennessee is about 1.6% as compared to 6% nationwide. So we've actually been spared the very high death rate seen in other parts of the country. When we look at our total cases, we're at 59 cases. 54 of those are confirmed, 5 are probable. We're now at 2 deaths. That'll be publishing and coming out today. Gary mentioned we're monitoring 15 and have 3 active cases. We've made big inroads into getting into our nursing home sites. We've already tested 2 nursing home sites, got 11 out of 19 on tap to get tested over the next couple of weeks. So we're making big inroads into that. And then we'll be testing a couple of other nursing homes as of today. When we look at our nationwide stats and where we're going as a nation, it appears to be plateauing and the number of deaths may be flattening out. compared with the rest of the country. There are a number of hot spots. We are very blessed not to be in one of those hot spots. Our numbers are actually, case rates are staying between 1% and 3% daily increase in case rates across the state of Tennessee. The bulk of those reports are coming out of Middle and West Tennessee. A lot of jails prisons have got significant disease within their systems. We've not been able, we've not had any cases actually within our jail systems as of yet, but that may be from lack of testing, but we've certainly not picked up any active acutely ill cases that's so critical in the definition. We're also starting to get some antibody test results coming in through the private sector, and we continue to enter those into our data systems. However, we have to stress the most important thing is to diagnose the disease early, and that's with virus transmission. So the PCR tests remain the mainstay of identifying, and then of course if we identify, we either isolate and then quarantine the contacts. With that, I think we're doing a pretty good job with that right now. We're holding up pretty good. We're continuing to follow our ILI numbers, and our influenza-like ill numbers have continued to decrease as is expected for the season. However, as we get into fall, we'll have to be marrying how does ILI correlate with COVID-19 disease and possible resurgence for the fall. Any questions for me?
I have one, Dr. May.
Go ahead,
Go ahead.
No, go ahead.
Okay, on some of the early release programs from the prisons and some of the county jails, are they doing any testing of these inmates prior to being released?
At this time, we're not doing that in Sullivan County and not got any significant inroads into jail testing here for Sullivan County.
Thank you.
Dr. Mays, my question is, you had mentioned, unfortunately, there had been a second death. In listening to some of the information that's coming out of Washington and the task force, are we seeing with these deaths, are there issues of comorbidity, or are they true isolated COVID-19 deaths?
No, they have comorbidities, and that's very, very common with COVID-19 deaths. They usually have multiple other medical problems that complicates the disease and can lead to their death.
And based on, we get the reports every evening, and thank you very much, because I'm sure it starts with the health department, but to Bill and staff and forwarding those on to us. We have been in phase 1 now for 2 weeks. Do you see us transitioning to phase 2 anytime in the future?
I think that's going to be working with the state and looking at statewide numbers. Certainly our numbers are in very good shape. I still think we need a little more time to see what's going to happen with the reopening. We've not been reopened hardly 2 weeks yet.
Right.
And of course, that's just getting through the incubation periods to see what really happens as people get back together. With our increased testing, I think we've got the capability to pick up those people who may be ill earlier, particularly with the testing. But we still just have to continue to monitor. And this is where this messaging of the physical distancing, we've got to keep that up. And then also mask on anybody out in public. And in reality, we are not seeing very good compliance with that. Now, if you maintain your 6 feet distancing, you're in pretty good shape. But certainly anything where you've got closer than 6 feet, you should be wearing a mask on both parties, whether they're ill or not. And we need to be practicing the adage of, we assume everyone is ill, and thus we all wear our mask when we're in public.
And then I just have one last question. We've heard so much about testing and contact tracing, and y'all have done a great job of talking about that. In our area, how how are we as far as supplies of testing? Do we have adequate testing materials for those that are reaching out to be tested?
Absolutely. Right now we're doing real well with maintaining our testing supplies and our PPE. We maintain a phone center that's active every day. So if you call and desire to be tested, we can either get you tested through both sites of the health department, Blountville and Kingsport. Ballard continues to do their testing, and more testing is also becoming available to private physicians, although that's been a little slow on that side coming up on their side. It is available through all the laboratories now. We have plenty of supplies, and thus that's allowing us to go ahead and do this advanced outreach into our nursing homes.
And so with that being said, are we in a position to begin stockpiling testing materials, PPE, so that if we have a relapse of any nature in the fall, which we know that we will have some additional cases, are we in a position to stockpile testing and PPE?
Well, now we're still working on getting extra amounts of PPE, particularly working with EMS, because we know this fall we're going to need a lot more. It's still a challenge to get some elements of the PPE. As far as viral transport media and the Dacron swabs needed to use for testing, we get a large amount of those through the state of Tennessee working with Shock Logistics. And they've been able to provide us with what we've needed. And certainly when we look at having massive amounts as we go into the nursing homes, testing 300 people a day or more, we've had adequate supplies so far. That's viral transport media is a little hard to stockpile lots extra because you have to worry about expiration dates and maintaining the sterility and all that of the media. At present, we have plenty to do what we have planned for, and we've been able to get plenty of supplies thus far.
And just for public education, how is this being paid for?
At the present time, the viral transport media and the testing is being paid for through the state. We actually submit the invoice from the private labs that we collect specimens for back to the state, and they are paying those invoices.
Those are actually more descriptive. They are federal flow-through dollars. The PPE is federal flow-through. The testing is all federal flow-through. And I might add, it's several $100,000 that the state of Tennessee, through those federal dollars, has spent in Sullivan County. Just to give you an example, our hepatitis outbreak that we had a few months ago, just one episode cost $360,000, all paid for by federal flow-through dollars to the state of Tennessee. So it's not insignificant. Each one of those tests wholesale is $70 a piece.
Thank you.
Dr. May, on the antibody testing, is there any information you can give us? I know you said you're just starting to get that in and get that entered. Is there any information you can give us of what that's looking like right now, of what you have received as far as any percentages that are showing positive?
Well, we have received a number of tests from outside laboratories that are reported in to our health department, and we record that into the state database. It's important, though, to understand that currently there are only 12 FDA approved tests used primarily through CLIA certified laboratories. Mm-hmm. There's about 120 other tests that are not federally approved by the FDA. And so we had to ask ourselves, what's their rate of false positives? What's their rate of false negatives? What do they really mean? We still do not have a good understanding of, does this mean immunity or not? And if it does mean immunity, how long does it last? It is really more of a long-term trying to understand, well, what is the penetrance within the population? And with that penetrance, is there an element of herd immunity? We're way too early to even be thinking about that at the present time. But as we accumulate this data, it can give us some insight into how it's penetrated into the actual population, and may give us an idea if we are developing herd immunity when we start seeing 70 and 80% of cases. It is not useful for the acute diagnosis of disease. All it means is that you have been exposed and have mounted an immune response. But it does not tell you whether you have acute disease. It does not tell you the severity of the disease. And really, we don't know if it means long-term immunity at this point in time. So at present, we are not really pushing antibody tests. I think they will be more widespread as we get further into the course of the disease, probably over the next month to 2 months. And we are tracking those results in our systems and have been factored into our data monitoring that we do with the state.
Thank you.
But one thing I think it's important, because that is what national news media focus on, but a complicating factor in this antibody testing, especially from a public health standpoint where we function, is that the FDA has done, shall we say, a great job of getting antibody testing out to the public. However, as we meet, I believe there are only 12 labs that are FDA approved for antibody testing. I've seen reports as high as there are 70 companies promoting and selling antibody testing. So there are some question about the accuracy or false positives that the test is producing, and folks are reacting to that. And so we don't really have clear understanding yet in public health as to what are we going to do with it, shall I say, the wild, wild west of antibody testing, and what does that mean to us in terms of public health?
Thank you.
Dr. May,
I invite Dr. May to correct me on that point, since we're in a public venue.
That's absolutely correct. Somebody else had a question.
Yeah, Dr. May, I had Gary and I have had a little bit of email correspondence about a report that came out of NBC about the Department of Human Services running testing on how sunlight kills the virus. And in particular, it was referenced around, well, and showed a lot of pictures of playground equipment, beach chairs, that kind of thing. And Gary and I researched it a little bit. I couldn't find anything specific. Gary couldn't find anything specific. And so I think one of the things the city is wrestling with is, when do we allow our playgrounds to open up? Our parks are open, but when do we allow our playgrounds to open up? And so my question number one is have you seen anything about how sunlight kills the virus, and, you know, spring and summertime type heat? And secondly is, do you have any indication in phase 2 if our playgrounds may be able to be opened up, and just any guidance you may have there?
Well, we know ultraviolet light kills lots of viruses, and it is an effective disinfectant. I can't really quote on how much time and what's the concentration of UV light that's actually required to kill. But when you do talk about your playgrounds and disinfection, it still comes back to looking at playgrounds. Are you able to keep those kids socially distanced or physically distanced, as in 6 feet apart? I think that's the more important question, is aside from disinfection and all that, you got to have a method that you can work on standardized disinfection. And then, you know, I don't have the answers for you as far as sunlight, how long does it take, and all those in particular. But the other thing you have to concentrate on, though, is that element of physical distancing at playgrounds can be very challenging if you've got a bunch of kids playing there and getting in contact with each other. So I think that's the more important element looking at the physical distancing and how are they protecting themselves from transmitting it from one to each other. Children, as you know, many times don't develop any type of illness, and they can be very good spreaders. We know in the fall they're the little walking cesspools that transmit disease so quickly throughout our population, and all of our flu epidemics begin with the children, and then they move it around. So the real question is, how are you going to maintain that physical distancing? And then the periodic disinfection, I think, is important too.
It kind of leads up to the question also about swimming pools. I know I've been asked about that, and phase 2, do you see the playground, children's areas, playground areas, swim pools, that kind of thing? What's your thoughts on that direction? Are we going to follow? I'm assuming we'll follow the state guidelines, which we have been doing, but does phase 2 address any of that?
I don't have specifics on phase 2 for for pools systems, but I do know that in phase 2, schools will be opening back up. They will allow larger groupings up to gatherings of 50, and I'm sure a lot of that verbiage will be contained. We do know chlorine in the water deactivates the virus, but you still have to come back to the element of that physical distancing and maintaining that separation, along with respiratory protection when they're in contact with each other.
I was looking at phase 2 according to Opening Up America Again reference guideline. Large venues, movie theaters, sporting venues, places of worship can operate under physical distancing protocols. Daycare camps can reopen. Gyms can open. These are the federal guidelines. It doesn't specifically state pools, but you can have gatherings of 50 people or less. So that probably would be strongly, not speaking for the governor certainly, but I speculate that would be strongly considered by the governor in phase 2.
So I think on the task force calls that we are fortunate enough to participate in, they're working on pools right now, with particularly the motel hotel industry, working on those, and that they really never were specified for being closed at the motels for those types. But again, taking the safety measures. So I can't remember for sure if they're going to come out with specific guidelines like they have in many of the other areas, or just in discussion for how to clarify that. So it is on the radar screen for the state task force that's been working hard. So
okay, thanks.
Yeah, also just youth sports have been a question, and at a recent meeting, the state talked that there were no states that had opened up youth contact sports. So it's not just us, it's across our nation. No state has gotten to the point of feeling like the time is right for moving into youth sports. So, and they'll be addressing that at some point too. But at this point, we're still farther away from those youth sports, which is disappointing for our children, but we've heard some of why. Lee, did you want to say something?
Yeah, I wanted to ask one last question, Margaret. Thank you. I'm just curious about traveling. I understand about the youth sports completely, and as a grandmother of 3, I'm all about the greater protection here, especially with this Kawasaki-like syndrome that's presenting itself now. But in regard to travel, where do we find ourselves in regard to travel outside of our immediate area?
Okay, looking at the guidelines and the way things are published, number one, anyone with high-risk comorbid conditions should continue in phase 1 to be sheltering in place. That's the number one. Number two, all non-essential travel is strongly discouraged. If you do have to travel, you must maintain those physical distancing guidelines and be sure that you're masking up and going safely, keeping your hands washed, and minimizing your contact with other people. Those are the basic guidelines.
When you return back, should you be quarantined, or if you're healthy and have not, you know?
The only reason that now, if you've had known contact with a confirmed COVID case, if you return ill and have any type of respiratory symptoms, you should see your primary care physician and or consider testing to be sure that you've not picked it up in your travels. So basically, if for anyone with any type of illness, we're going to continue to recommend isolation for those who have any types of illness, and they may need to consider COVID testing. If they return, they've behaved, they've not been to a large beach party, they've maintained their physical distancing, they've worn their mask, they've washed their hands, then there's no reason at that time for their quarantine.
Thank you. Bill, this may be something that, and John's always 20 yards out in front of us, but to be sure that the community, as we go into travel season, the summer season, to be sure that people are aware of best practices moving outside of the area if they have to go.
It's a good idea.
Yeah, the other thing that I assume is helpful, since we know contact tracing is so important, that if we can keep a calendar of where we've been, particularly if we're out of town. So if you're going out to eat or going somewhere, that you make note of which day that was, what hour, whatever, so that if contact tracing is necessary, that you can remember when you were there and how much time you spent there, et cetera. So, and that could go for at home as well, to just make note. And then that, I assume, Dr. May, that can make it easier for contact tracing if it's needed. So
absolutely. In contact tracing, we'll always go back 48 hours before the onset of symptoms. So when we first see those symptoms, that's an important date. We'll track back 2 days before, and then of course, any contacts after the onset of illness.
thank you. And I'll just note, our state has chosen with their federal dollars to spend quite a bit on testing, which is a best practice with this. Also, the provision of masks, they hope to, and there'll be several more deliveries. It's a company out of Cleveland, Tennessee, that the state has contracted with. So that's the message to us as citizens, that our lives are, as Tennessee citizens, is greatly valued, and then it's up to us to follow these practices and to pick up those masks, to use those masks when we're out. And it's a little concerning when we see large groups of folks out there without masks. There's also lots of information about exercising with masks on, going jogging with masks on, in all kinds of different circumstances, with the best practices for how to wear your mask, when to wear it, and why it's so important to do that. So,
and I sense that we're wrapping up, Mayor, and if I may, I just would like to say a couple of things. One is, I want to repeat my sincere appreciation to the council for involving the health department and asking us to provide information to you and your citizens. I want to thank Mayor and congratulate your city staff, City Manager Bill Sora, and all of his team that have worked with us over the last few weeks in a very cooperative and spirited way to help minimize the spread of COVID-19. Very appreciative of Bristol, Tennessee school system for working with us so diligently, and that's vital to our success as a region. And also a couple of things that are very, very important as we move forward. And there are three hard stops, if you will, in this effort that we're in the pandemic. And one is our health system capacity. We understand where we are, and we're very, very grateful that our numbers are like they are. But we need to understand what our health capacity is. That can put a hard stop on our movement forward. The third item is PPE. PPE for our public safety personnel, our police and fire and EMS, especially our EMS. If they don't have adequate PPE, that's a hard stop on moving forward. And the third thing is public health, the Sullivan County Health Department's capacity to do contact tracing and cluster investigation and case follow-up. And obviously we will be augmented if need be. I hope we can be by the state of Tennessee, should that, but those are three fundamental things that we have to have in place to continue moving forward. And all the other things that we're talking about to minimize the spread of COVID-19 throughout the next few months is important. But those are the high peaks of importance, I believe, as we move forward. And again, I'll say thank you for this opportunity.
I've got one more question, and for either Gary or Dr. May. On this testing, are we recommending for everyone watching right now, are we recommending on this testing of someone that doesn't have any symptoms, they do not know that they've been in contact with anyone, to go and get testing? Are we, the fact that I know there's a lot of people that are going to get testing, have no symptoms or anything else, are we recommending that or not? Because I think that would have.
We're moving away from what I consider blind testing. We know that 95% of those who are blindly tested are showing up actually negative. The real point that we need to focus on are those who develop any type of respiratory symptoms. So fever, cough, congestion, headache now. If you develop any of those types of symptoms, that index of suspicion is so critical. There's lots of questions that's going to be surfing about, well, how often do we test, particularly when we look at the high-risk vulnerable populations? Do we go back into nursing homes? How often do we go into nursing homes and do blind testing? I think for the general public, if you develop any type of respiratory symptoms, we want to get you tested, especially now that flu season and the other respiratory viruses are low. There's a high probability then that if you do develop a respiratory syndrome, that it may be COVID. So those are the target populations we really want to get them tested. As I stated before, antibody testing is not really very valuable in detecting acute disease. The antibodies tell us that you did get exposed, and your body mounted a response. The PCR testing for the actual virus is the most valuable tool that we have in detection, and thus allows us, once we detect it, we can use the isolation and quarantine measures that's so valuable and been so proven. Does that answer your question?
I think so. Yeah. Thank you.
So I think on that, what I, and Dr. May can can correct me, but I think with this, we learn so much as we're going on, and that makes it a little bit harder because sometimes the information changes. But I think at the beginning, we were limited, so it was testing people with symptoms. Then we opened up, I guess, to blind testing, which helped us determine that it's that 95%. So doing that helped us see what our population looked like. And now we're moving back into testing those vulnerable populations with nursing homes, et cetera, and people with symptoms. Is that kind of the picture, Dr. May, for where we are with testing, where we've come from?
Yes, that's a correct assessment. And then the other, we're going to be looking at other vulnerable groups. So high congregate settings, looking at your jails, looking at large apartment complexes, looking at the other vulnerable sections. And in the state of Tennessee, they actually have 4 separate teams that are looking at testing strategies, working with Unified Command through the state and prioritizing that level of testing.
I assume minority testing is part of that too, and I know that that's been targeted with some of the testing through our health department, but we know that that's a higher positive response with minorities across our country.
Yes, that is true.
So, okay. Anybody else? And again, we appreciate greatly your time, and also we hope that that this is not just helpful for us, but there are folks who, when they see y'all are going to be on the agenda, tune in to get a very thorough update. And it helps us to really appreciate the role of public health at all times. Also, I think y'all are hoping to get back to some of your regular health department functions that have been put aside by the beginning of June. Is that correct?
Well, we've been planning on that effort, but again, the response to the pandemic is our #1 priority right now. And so allocating resources for that hasn't changed. So I'll be honest, we haven't really figured out how to get back to normal yet with everything. So we continue in that effort as much as we can.
Thank you. I know some folks really depend for some of the different screenings, et cetera. So, and vaccination programs and some of the clinics y'all provide. So hopefully some of that can come back to us. So anyway, we greatly appreciate you very, very, very much. So
thank you.
Thanks for spending time with us. Okay, I think we have a big section on our mostly the rest of our agenda is one that we've been asking for at the last meeting, and Mr. Soares put together a program to help us be in a position to look at what opportunities we might have.
Yes, Tim Beavers will join us momentarily. And he's going to talk about the code, the building code adoption process, as well as the International Energy Conservation Code, where we are in terms of an organization, what we adopted and when we adopted it. And then he's going to contrast this with what our peer communities around us have adopted, the various chapters that they've adopted, and the timeframes for the applicable charts within their codes. He's also going to talk to you about what the state is doing. I think he's going to cover primacy, how Bristol, Tennessee, as how we have the statutory ability to review plans and inspect construction and so forth, as opposed to the state providing that service. So, Tim, you want to give them some historical guidance as far as how we got where we are, and the various chapters that we've adopted, and then what others around us are doing, and then where we can go from here if council decides that they would like to go in a different direction. Yeah.
Sure, thank you. Y'all have a lot of information that was sent to you on building codes, especially there is a huge chart that was put together showing where the different Tri-Cities are on the building codes and what they've adopted and the exemptions they've taken to each section. Currently, the city of Bristol in January of 2012 adopted the International Code Council 2012 codes, most of the volumes of that code. Specifically, we have the International Building Code, International Residential Code, and International Energy Conservation Code, along with plumbing, mechanical, property maintenance, performance, some others that you have listed in your memo from me. The reason we adopted those is because we are an exempt jurisdiction by the state, which means we have the authority to review plans and documents regarding construction in the city and issue building permits. So those permits do not flow through the state, with some exceptions for like schools, healthcare, things like that. So it is a value to the area for us to be able to do that. So they're not sending them to the state and waiting on the state to review those plans. They're dealing with local people. It's easy to get a hold of us and talk through building codes when people are looking at the issues that come about. In general, like I said, you have a huge chart that shows what everybody has adopted. And the state of Tennessee, they're currently on the 2012 version for the most part of the codes, except for the the International Energy Code. They are on the 2009 version. So what I want to do is, since in general, most of our conversations in the past have been about residential codes and building codes, because that's where I think we differ most with some of the localities in the state. I just really want to focus in on residential codes and the energy code, that portion of it. One thing also about being an exempt jurisdiction is we have to stay current within 7 years of the latest published building codes. Currently, 2018 is the latest published version. So we are good right now. The codes, they will come out with a 2021 version. They come out every 3 years later this year. So we will have to move from the 2012 version to some version of the codes that are within 7 years of that 2021 version later this year. The state also they are on the 2012 version, like I said, for the most part. They are looking at adopting the 2018 version of the building codes. Our understanding is they'll take some exemptions to the energy code and may stick with the 2018 version and adopt some 2009 tables out of the energy code. So, like I said, I want to just step and draw back down to the residential and the energy code, because that seems to be in all this different areas where there's a lot of varied things people have adopted. Currently, Bristol on the International Residential Code is 2012 version. Kingsport is on the 2018 version. Johnson City, the 2012 version. Sullivan County on residential is on the 2018 version. And the state of Tennessee is on the 2009 version. The biggest things you will see in looking at all those versions of the residential code, the difference between us at the 2012 version and all the others. The other jurisdictions have taken exemption to what is called the building envelope tightness test. And most people know it as the blower door test, and it's actually testing how tight the building envelope is. Now, Kingsport in January of this year, 2020, their ordinances require that blower door test for their residential construction as of January of this year. Also, the duct blast test, so your air leakage test for your HVAC system ducts in unconditioned areas, so areas that aren't inside the conditioned envelope of the building where your heat's regulated and air's regulated. So those unconditioned areas, there is a duct blast test that we required that everybody except Kingsport does not require. Once again, Kingsport adopted that duct blast test in January of 2020 of this year. In regards to the energy code, Bristol is on the 2012 International Energy Conservation Code. Kingsport is on the 2018 version of that code. Johnson City on the 2012 version. Sullivan County on the 2018 version. And the state of Tennessee on the 2009 version. This is specifically when it deals with residential. And the biggest difference between us and all the other on the Energy Conservation Code is we do not go back. Most of them reference the 2009 insulation and fenestration. So your openings and your insulation thicknesses in walls and ceilings, those are different. The 2012 version of the code does require higher insulation values, that table in the 2012 version, than the 2009 version. And that would mean your walls would be thicker, probably 2x6 construction. There are some other options there, but in general, 2x6 construction instead of 2x4 construction. And the biggest thing also we see is the area between the roof trusses and the ceiling joist. There is an additional area between those two. Most come down, the roof truss will meet, excuse me, the wall and the ceiling joist at the eave. But with the 2012 tables, there has to be an additional depth there between those two meeting points so you can add more insulation. So that is the biggest difference in the energy code on residential from the city and everybody else that currently has these codes adopted. Now I think you were provided with, there is a document that looks like this, produced by the U.S. Department of Energy, and it talks about the cost savings of energy efficient homes between the 2006, 2009, and 2012 energy codes. It's a very good read, a very good document that shows that there is a payback for homeowners with energy efficient homes. And we have also spoken with realtors, and they do see in new construction people wanting to buy more energy efficient homes. But it is not a life safety issue. It is not required by the state of Tennessee that we have the 2012 tables. That is just what was adopted back in January of 2012. 2018 version of the Energy Code will be very similar and have similar tables. Like I said, we do believe the state of Tennessee will go back to the 2009 tables on the Energy Code. We do not know at this time if they will mandate the air tightness test or the duct blast test. They are working through those codes issues right now and should adopt something tentatively this summer. And once that is adopted, then obviously we need to evaluate what they adopted, what exceptions they took, and look at upgrading our codes to make sure we stay within that 7-year compliance period for later this year. Also, the codes department, Matt Bailey, the codes administrator, has been working with his peers in Kingsport, Johnson City, Sullivan County, Elizabethton, and the region on looking at moving to the same codes throughout the region and trying to get everybody on the same footer of codes so that when you come to the region, you would have a code that you could say would apply in all the areas instead of looking at the various differences between codes. As you can see by that chart, there are a lot of exceptions taken to each and every code, and they vary from place to place. So they're trying to get those down into a more comprehensive and understanding why one city may have adopted this exception to a code versus another city. Like I said, they're trying to get some commonality there that will make it easier for builders coming into the region to adopt, work in the region and not have to worry about the nuances between each building code between the Tri-Cities. In general, that's all I have. I think, like I said, you have a memo from me, a memo from Danielle, and a lot of data there. I do believe that like I said, we will have to move to a new code. It doesn't have to be the 2018 version. It just has to be within 7 years. So it could be the 2015 version, but we would recommend to evaluate what the state does later this summer and then adopt something similar to what the state does. So with that, I can try to answer any questions. I'm obviously not the codes guru for the area, but spent a lot of time in codes the past month looking at the nuances. So,
Tim, I have one, and Vince, you may have some insight on this as well. If a person goes through a energy program sponsored by TVA, say insulation, doors, heat pump, those types of programs, or even windows, what code would you think that Bristol, Tennessee Essential Services requiring to go through the TVA programs?
well, I can't answer that. Maybe Vince, you might have some insight. I know that currently to get a permit for residential in the city, you would have to use the 2012 energy code for us or something higher than that. So, but I don't, Vince, you may have some insight on that.
TVA has their, I mean, TVA has, I don't know exactly what those, as far as the specifications, but all of those come from TVA, and anything that with BTES, if any of those programs, they have to abide by whatever those are set forth by TVA. And I'm not sure what exactly I don't know that they use a certain, theirs has to do as far as the unit itself, as far as how efficient the electric heat pump is, and all of that. You're talking about electric. You know, there's going to be others of where there's some that they may be on gas, natural gas, but because all of those, we're just strictly talking about electric hot water heater, electric heat pump, so forth.
Yeah, I know they would. I'm going back several years ago on a program for a heat pump. You know, they would come in, inspect your insulation, recommend, you know, things like that. So I mean, very, very, very good program though.
And may address more cost savings for energy use by using the TVA program. So,
in a nutshell, if you look at this, I think, you know, I'm a big proponent of energy savings, but we've talked about how we could incentivize situations so that we have developers that are more interested, more eager in coming into our area to develop. You know, when we look at the cost effectiveness, the 2009 versus the 2012, you're looking at about $4,400, but that's to the consumer. That's not to the developer. And if you look over on page 4 at the consumer's cash flow from 2009 to 2012, you're looking at a net annual cash flow savings in 1 year of $288 versus $282 in 2012. And I support this aspect of it, but I think, Chad, you know, when you brought this up, is we were looking at it, how can we, what is it, what codes do we have that could be more costly to the developer? And so something that and Tim, maybe it's in all this and I just haven't found it yet. What is the cost differential between the 2009 to the 2012 for the most part? If you took a same sized single family home, what would the cost savings be to the developer under the 2009 codes versus the 2012?
That is in, and I'm flipping back through that study there. I just had it. There is a difference in total construction cost. It's on page A6 in that report.
Okay.
If you click, it's like 1, 2, 3. It's 4 pages from the back.
Got it.
So you will see that we're zone 4. So you can see the difference in like a 2,400 square foot home. You got an unheated and a heated, but you can see the difference in cost. 2009 energy codes about $543 additional cost. 2012 energy codes about $2,300 additional cost. So And that's from the 2006 version. So, you know, you're about $1,200 or so there, difference, about six.
Difference to the
Between the two, about $1,700 there, difference in the cost between 2009 and 2012 per this study. I mean, there's a lot of factors that go in that, like you said, house size, is it a slab on grade, is it heated basement, and things
number of
like
windows.
number of windows. I mean, there's a ton of different factors, but that's the best, you know, trying to look at a comparison between the codes. That's the best document that I've seen, and trying to dig through this. And like I said, that was by the U.S. Department of Energy for the state of Tennessee, looking at the difference in cost of those codes.
So it comes out to be about $1,750
Yes.
differential
Yes, ma'am.
between the 2009 and the 2012 codes. And so if I understood you correctly, including the state, most all around us are following the 2009 energy codes along with whatever international codes they've adopted, whether it's the 2012, 2018, but most are going back to those 2009 energy codes.
Yes, the other jurisdictions, including the state, drop back to the 2009 table at least. The state has, for residential, just adopted the 2009 energy code in whole for the state of Tennessee for residential construction. And like I said, most others that have adopted the 2012 or 2018 have cited the 2009, and it's the insulation and fenestration, which means your openings. Fenestration is the openings table, and that specifically deals with R values and U values and all those fun values for transmission of heat. So,
and so would be a proportion. You know, if you look at the 1,200 foot apartment condo, you're talking about $800 difference between 9 and 12. You know, and the larger you go, the numbers would be even bigger, but there would still be that percentage of differentiation, correct?
yes, according to the study, yes, ma'am.
Mm-hmm.
So Kingsport adopted in 2018, that includes the updated energy code for them, or they didn't go back, is that correct?
They adopted the 2018 International Energy Code with the 2009 basically tables, and that's the R values. And that's where we think the state, that's what they've talked about doing, the state. Okay. Like I said, Kingsport, the only difference in residential construction is that Kingsport did, as of their regulations as of January of this year, required the blower door air tightness test, building envelope air tightness test, which is your blower door test, and the duct leakage test, which is your duct blast test. So they do require those now per their regulations. Where we were different before, we're the same now, us and Kingsport, on those two tests, but that is not part of the energy code. That's part of the residential building code.
So it's 2009 energy code with the Kingsport with the addition of those two tests.
Yes. So Kingsport adopted the 2018 International Residential Code. And I guess initially they excluded those two tests in that adoption and made them effective January 1, 2020. So their ordinances currently require those tests.
But Johnson City does not require those tests.
No, sir. That Kingsport is, and us are the anomalies in the Tri-Cities. Yes, sir.
Aren't those tests themselves in the $2,000 range, coupled together?
Those tests, obviously, you have to have the equipment to do those. But once you have the equipment, you just, you can reuse it for home to home. And other than the time to set it up and run the test would be your cost difference there once you purchase that equipment. So, and the thing with it, you're going to have to make sure, obviously, if you run those tests, is that you have provided the required tightness of the building envelope.
Well, I guess my question there is most likely a developer would hire someone to do that, perform that test.
They can if they want to, yes, sir.
And okay, so I guess I'm trying to get the normal on that is if they hired someone to do the test. I don't know of a developer that I know of, and maybe they all do it now. I'm not sure, but what I have heard is that they usually will hire someone to do the test, and that the cost of the testing is, fairly substantial.
That's their choice. I mean, I have not looked up at that equipment cost to see what the testing equipment runs for those two tests.
To put a house here or to put a house there, I would see that as being the norm. But if you're going to come in and do a complete development with multiple homes, most developers will provide their own equipment to do that. Depending on the number of homes that they're putting up. If you look at some of the large developments that have gone in other areas within our immediate region, common sense would say to me that they would probably buy their own and do their own if they're going to put in 50 to 100 homes.
Well, I mean, again, I'm not worried. Not necessarily. I understand we can reuse. Someone can reuse the equipment. That's not the question. Right now is we don't have a major developer in Bristol. Let me say this. We do have developers in Bristol, one in particular development that I'm thinking about right now, but we don't have another a development going in that says, okay, we're going to have 150 homes in this area. It's being performed by D.H. Horton or whoever it may be that comes in and says, we're going to put this number of homes in this area, which I would agree if they required that. If the codes required that, then, they're going to get organized and do that. But again, when we refer to Johnson City, Washington County, Tennessee, and area where we are seeing, developments that have several hundred homes in them, that code's not, or that test is not required. So in our area, I would assume that, as you mentioned, when you're building a few houses here and a few houses there, that they're probably sourcing this out to someone, and I have been told that that's pretty costly.
I'm sorry, Vince, go ahead.
I guess I don't understand the fact that if we're requiring the test, why would we not be performing the test if we're requiring it? It's kind of like an emissions test on your car. Or do you need to buy that equipment to do the emissions test on your car if you live in Virginia? I mean, I guess that's the point I don't understand of why, if we're requiring this test to be done, why would the developer have to buy the equipment and everything to do the test? Would we not go in and do the test if we're requiring it?
We don't currently provide testing services for plumbing tightness test or any of that. I mean, that's just most of your codes departments, building departments do not provide the testing services that are required for the different types of construction. That those are provided by the developer, or like Chad said, they hire somebody to provide that. So,
okay.
There's probably a certification or a sign-off sheet on those aspects, I would imagine.
Here's my $64,000 question is, what is it that we want? What is, we have all this information. What is it specifically that we are driving towards? What is it that we want to see as the end result? Is it that we are trying to incentivize developers to come in with residential building? What is an appropriate incentive package? Is it dealing with the energy codes? And we have more conversation to come, but I think we need to, as a council, to the point of giving staff some direction, what is, in a nutshell, in a statement, what is our end goal?
Well, let me tell you what my thoughts are. But when we get to the sweet spot on what developers and a lot of realtors think Bristol is, we're talking about houses that I'm going to say sell for around $200,000. So within the codes, in what I have heard is in most cases, when you're talking about houses in that price range, difficult for developers to make money or not as much money with our current energy codes. Now, whether that is $1,750, I think it's closer to $4,000 per house, but let's say it's $1,700, $4,000, somewhere in that neighborhood. That takes a large chunk of the profit on a house. So if we're talking about a house that there may be a 10% markup on, you're taking 25% of the profits, and it's just not a level playing field for us. If we go to what, in my opinion, we should go to what we should match the state in codes. So if the energy codes are off the 2009 table right now, I'd like to see us move to that. Relax the two things that we hear from our developers is regulation, and market. And when we're talking about regulation, if we can relax things and get us on an even playing field, I think that's number one. If we can incentivize developers through infrastructure, and I really think this could be along all price houses, if we can incentivize, through our water sewer fund, basically $1 tap fees, and grant, or let me say this, grant water and sewer infrastructure, that definitely is a great incentive. I know we're checking into that to see if that's something we can do. So we'll, continue along those lines. As we talk about another thing that I think could be advantageous for us in the lower to moderate income housing is it possible to go through, and this is a Joel and Steve question, as well as if Tom's not here, but through the IDB or the Housing Authority, is it possible for us through the Housing Authority or the Industrial Development Board to give grants for families that qualify in the low to moderate income, give them a grant? For instance, if someone is under the family income of under $50,000, $55,000 is what I think I saw is considered to be low to moderate income. There are grants through the federal government, maybe through the state, but also can the Housing Authority give a grant to that family as well if they qualify? Well, if we're talking about someone who makes that $55,000 a year, they would qualify right now for a mortgage, a house that would cost around $265,000. And they would be able to pay a mortgage 30% of what their income is, which is pretty standard through banks. So if there are grants out, if we can issue grants ourselves, also help them get federal grants and state grants, I think that would be a huge thing. So relax building codes, incentivize through our infrastructure if we can, and we're checking into that. Possible grants to lower and moderate income families. And one of the biggest pieces of information that I saw in here was to utilize the competitive grants program, the home program, National Housing Trust Fund. And also, I think the last thing is in our listening sessions, that when we're talking to developers and realtors, we need to include bankers in there, which could be the group that really gets the information out to our incentives out to individuals and developers. And, we have a multitude of information that comes out of our industrial development, at least some folks in our industrial development board, along with our housing authority. We've got planning commission members that are very knowledgeable in this area too. So when we're hearing from our developers and bankers and realtors, include all those folks, and I think we're going to get a whole lot more information, is the 5 steps that I think we should try to go into. Relax, give incentives, possible grants, and look at all of the types of grants from other areas besides the housing authority, like the competitive grant program and things of that nature.
I think we have a real opportunity to put together a comprehensive plan. I would probably ask staff to take a look at this, the energy codes. You've taken a great dive in that, and I appreciate all of your information there. As far as the duct blast, the air leakage test, and the blower door as to how tight it is, I think that one thing that we want to be very careful about in looking at this is that we still have quality homes. We don't want to go so far in any one direction that we're compromising the integrity of the homes, because that really doesn't help our property value in the long run. It may help initially to get people in homes to have that property value as part of our revenue stream. But if they are not homes that are built so that they will retain their value or even increase in value, then we haven't looked at our long play best. But I think that that's important to look at. As far as incentivizing grants to developers with utility infrastructure, we've talked about that quite a bit. And when we talked about it initially, we talked about providing that incentive on the front end, and that there would be some type of repayment on the back end once the property was sold. And I don't know, Chad, if that was still part of it, or is it the one and done on the front end? But,
you could get a payback if you were to supply all the infrastructure. You could get a payback through the tap fees.
Mm-hmm.
And those tap fees could be, again, it depends on how we structure grants to the families. That could be part of the grants. But or when a developer sells the lot or sells the house on the lot, that could be paid back. I just think it takes risk off the table for them.
Well, and I assume you're talking about more moderate, middle income type housing when you get into that, and not necessarily a custom home at a higher price point.
I think your qualifications would be, what we're hoping to do is have a developer come in and say, okay, we're going to build 100 houses on this particular site. So, or 50 or 25 or whatever our criteria is. I don't think you could do infrastructure like we're talking about unless it's on a fairly mass scale. So if you have, a developer that says, I have this one lot, it wouldn't really apply for the infrastructure.
And I think maybe what you're talking about as far as the IDB or the housing authority, and this was touched on a little bit earlier, is that the IDB has the ability, I believe, to purchase properties. Is that a correct statement, Bill, Danielle?
They can purchase property. They can do things with private investors and with private developers that the city could not do. And that's one of the prerequisites, or one of the bases for having an IDB. They can incentivize certain things that
and so such a fund could be set aside specifically. And Chad, I guess that when we look at the $250,000 per year, somewhere in there, the budget, and it would be specifically to build a property acquisition fund that would have very well-defined qualifying expenses or opportunities to expand such a fund, right?
Well, I think you could use it for exactly that. But the other side of that is if you have a qualifying family
Right.
for new construction, if you had a qualifying family that met that low to moderate income, could we give them some sort of a grant through one of those two entities,
Right.
Either the housing authority? Could we give them a grant for new house purchases?
So that would be one of the defined qualifying expenditures out of a property acquisition fund, along with others.
Yeah,
But it would be one off.
It could be used in multiple ways. Yeah, let me put it out here. I'm I'm not saying it can or can't be, but that's something we should investigate to see if we can.
And I would,
I think
Bill
we've
needs
got
to-
a great discussion going as far as how to stimulate housing investment in our community. I don't think it's a one and done kind of conversation. I think this is a building block of information that we would like to provide for you all. We've got certainly the International Energy Conservation Code is one element of that, and building codes is an element of that. We know the state, or we believe the state is going to move to a different code this summer, which we will have to catch up with that as far as the International Building Code. But the Energy Conservation Code may remain at 2012 with 2009 tables. There may be some variations of that. We know we have to be at least as stringent as the state is with their regulations. So that's one element of this. I think where the conversation is headed now, I think as we get information from the comptroller's office as to what they feel like we can legally do according to statute, that will give us some guidance in those. I think certainly Joel and Steve they're on the meeting today to talk about ways that Bristol Housing and Redevelopment Authority, the tools that they have in the toolbox to help with some of the low moderate income to stimulate that type of housing inventory within our community. So there's a lot of moving parts to this puzzle and how you stimulate development in our area. Danielle is going to speak also today in regards to tap fees. I know the question has come up. Can we do things? It's come up in this conversation. Can we do certain things with tap fees? And the short answer to that is yes, we can. There has to be some uniformity to that, but Danielle will cover that. Next Tuesday, we're going to have a presentation by staff, and we'd also like to have someone from Netter involved in the Zoom meeting also to get some direct feedback from them as to the real estate market, what they see are drivers in the market, what's the consumer seeking, and so forth. So I think all of these are progressive conversations that I think it's important for City Council to have, along with information as to what we can statutorily do in terms of incentivize, leading into a larger conversation. When we feel like we've got all the information, then I think a good long work session to fully vet what council would like to see in terms of the development of a policy to stimulate residential. I think we're building to that conversation. I don't think it's a conversation that concludes today, certainly.
right. And I guess the thought today is that as to your point, Bill, you're exactly right. You know, this is a multifaceted conversation, and it's one that the more that staff hears the thoughts of council, it gives, I think, greater, as we walk through this, greater clarity as to where we're hoping to go with this. But I realize, me personally, 1 of 5, that this is something that we will have the conversations, we'll explore all of the different opportunities in regard to it, but that it will take the expertise of staff to put this together over a period of time so that we have that comprehensive plan of incentive to move our housing forward. That's just my one perspective. I support where we're trying to go with this, because it doesn't do us any good to try to bring jobs in, which we are. I mean, it's a process for people to live outside of Bristol. You know, we bring the jobs in, and then if we don't capture that property tax along with that job, then, you know, it's great to have the jobs, but we want to have the jobs for people that are living in our community or our region, but in our community, to help expand our property tax base. So I support where this conversation is going. You know, one other question that I have, and I'm sure Steve or Joel will address this: how much have we used the HOME program or the National Housing Trust? And so when they get ready to present, I'm sure they'll talk about that too.
Go ahead, Bill.
I suggest when we get to that point in our agenda, we actually have Joel speak next as an item, and then reverse order with Danielle, so that Joel and Steve can do their presentation, and then we'll have Danielle follow them.
Okay. Are
I'll
we
just-
ready
I was just going
to?
to ask one real quick question about the energy code, though. If we are expecting the state to go to the 2009 tables for the energy code, and probably we will have to adopt the 2018 international codes, if I understood that correctly. Is there, and you're talking about the summertime, which could be August, which is a long time away in the business world, 4, 5, 6 months away. Is it unrealistic? Is there a huge downside if we were to adopt the 2009 energy code now, and going forward state that we're going to match the state codes, the international codes and the energy code going forward?
I can speak to one part of that. You have to actually adopt the codes by reference specifically, and you have to talk about which parts of it you're adopting. And so I don't think it's enough for us to pass an ordinance that says we're going to just stay where the state is. So if you guys are going to go ahead and move to a different code now, you need to be aware of whether you're going to have to then turn around and move to make another change when the state makes its change. So those would be the things to think about. And there is some cost associated with getting our ordinance updated when we do that. When we send it off to Municode, and they're doing an update right now, it costs us about $2,400 every time we do that. So those are things to be thinking about as you go forward. If you are going to change an ordinance, of course, it's going to take you at least 2 months, unless it's some kind of emergency. And I don't know if this is what you would want to call an emergency. Okay. So even if you decided to start making changes at the next city council meeting, you're talking about June and July, and the ordinance change wouldn't be effective until, somewhere around July 20th, 24th.
Makes sense. Makes sense to wait. I guess the other thing that I've seen in multiple spectrums is with the coronavirus, it's stalled a lot of things, where it's put it out 6 months, or I'm curious to know if we're going to be in the same position in the summer of 2021 is the only thing that I was referencing there.
Malin, what do you?
I think overall, obviously we need to have a plan, to move forward with this. And we just have to be very, very thoughtful and careful. And I think, setting specifics is what we'd like to see, being detailed in that area. And I think it's always good. It would be great to get some housing going in this area again. I've done a brief survey just recently, asking a realtor to provide me some information. And right now there's not but 57 houses that's available in the city of Bristol, Tennessee. And usually that's on the average about 200, kind of a running average. Why the difference right now, they couldn't tell me. But most of the homes that I've seen, they're ranging anywhere from $60,000 up to $1.12 million. But most of them are in the below the $100,000 range that is available right now. Some good programs and good conversation going on with some moderate to low income housing. I'm not sure how the program operates over in Bristol, Virginia, but if you go up through Oakview Street, I don't know if anybody's gone through there lately. They built some very beautiful units over there for the lower income spectrum. That if you look at the home itself from the outside, it looks like a very high end development. So and I'm sure there's a lot of federal dollars that probably was used on that as well. So, but yeah, good dialogue, and I think it's a good starting point.
Vance, where are you with this?
Well, I guess with me is on the energy codes and what we're talking about of what's required, and I think it comes down to the individual, whether it be the builder or the person buying the home, of making that decision of if they want a more energy efficient home or they choose to go a lesser route. I think that's up to the individual person that is building or buying the home. And it's let the developers and let their purchasers make those decisions instead of us trying to make them for them. That's kind of where I am. I think that we've got to do whatever we can to attract developers here and keep people here, like you said earlier. So I'd like to see the lessening of some of the regulations, especially if the cost on some of this stuff, it sounds like can be detrimental to someone wanting to come here versus going somewhere else, and we're on the same playing field with other areas. So
okay,
that's where I am.
Okay, and I think it'd be great if we can keep moving on for more information and so that we do have all the basics for being able to be comprehensive in how we look at this issue. So Mr. Sora, do you want to introduce Steve and Joel with their program?
Well, both of these individuals don't really need an introduction. They're both familiar members, are familiar to City Council. Joel Conkin is with us today as attorney for Bristol Housing to talk about the various, as I indicated earlier, the various tools in the toolbox that they have. You know, we typically think of Bristol Housing and redevelopment of those redevelopment districts for commercial property, and that those areas where we've been very successful in utilizing TIFs to stimulate commercial development. This is a little different conversation in terms of what can be done in terms of stimulating low, moderate income housing and how they can help advance that discussion. So, Joel.
Good morning. How is everyone? Thank you for having me. Can you hear me okay?
Perfect.
Okay, great. And Steve, are you on?
He's muted.
Yes, I'm here.
Okay, I'll take your word. Hey, Steve.
Hey.
Well, I don't really have a set outline to walk through, but I talked to Danielle last week, and she said that she wanted me to walk through give a little bit of a description of the Housing Authority's toolbox for residential development. And so most of their focus is, of course, on low and moderate income housing, but I did hear some discussion about market rate housing and how incentives might be used for what we'll call, market rate or higher end housing. So TIF is probably familiar to everyone, tax increment financing. And that's sort of historically been used for commercial purposes, although we've used it for a couple of apartment complexes as well. But that statute was really started, and its impetus was to develop residential housing. And it certainly is available for use for any sort of residential development. Now, the key factor there with a housing authority TIF is the area, the redevelopment area has to be, have a finding of blight. So if you have a finding of blight, then you're not really restricted necessarily to low income housing going back in that redevelopment area. You could use TIF dollars from that district to incentivize any sort of residential, commercial, or other construction that the city deems appropriate. Now, again, you've got to have the blight finding for that area before it would be eligible to be declared a redevelopment district. So that is one potential tool for market rate that maybe hasn't been on your radar screen before. So that would be an option there. Now, how that would work on a small scale, the expense of administering the TIF program on a house by house basis might be something that we'd have to really work on to nail down from an administrative standpoint and have to think through, but theoretically it's possible, and I'll just leave that there. From a more traditional housing authority concept. Oh, let me say one more thing about market rate housing. The other tool that I've seen some cities use to some success is what I would call like a master plan community, where the city identifies an area and then they invest some money to create a park, some infrastructure, a school, something to make that area attractive to residential builders and buyers, whereas previously maybe it wasn't. And rather than direct incentives, it's more of an indirect incentive by creating a desirable area for new development. And I'm certainly not an expert on that, but I'm just familiar with that concept. So before I move on to what I'd call affordable housing, does anyone have any questions about those two items?
So so we have a redevelopment plan that we have identified some different areas. So at this point, if we took a look at any of those already defined areas, if any of them were appropriate for residential, then we'd be already set for those particular areas. Is that correct?
I think there's some study areas that, probably are, maybe appropriate for residential development. I'm not totally familiar with the area sort of block by block, so I would leave that up to Steve and others. But yes, I mean, once those study areas were declared actual districts, right, then potentially you could have a TIF project for some sort of, planned unit development or some sort of bigger project. The scale makes it a little easier from a TIF standpoint, administratively and approval wise, but it's theoretically doable, on a smaller scale. Mm-hmm. We just have to work through how that would be administered.
Okay, thanks.
So moving on to affordable housing, that terminology is something that maybe needs a little bit of a definition. The focus of most new affordable housing development is what we would call mixed income and mixed use development, where you have a mixture of potentially commercial, potentially market rate, and lower income housing all in the same area. And the idea is, rather than, we don't want to create these neighborhoods that maybe have stigmas of the past of being, this is your lower income neighborhood versus market rate. And so the concepts have been encouraging mixtures of those sorts of uses. So it's fairly common now for low income housing, in the traditional sense, to have a mixture of market rate and rent restricted units in the same development. And that's, in order to do that, usually the quality of construction is pretty high. The curb appeal is good. So most of the tools available I heard mentioned the National Housing Trust Fund, and Tennessee also has an equivalent of that, the Tennessee Housing Trust Fund. Those are often used in connection with low-income housing tax credits, which most of you are probably familiar with, but that's a federal program administered through THDA. And then there are two actual sets of credits. There's the 9% credits, which are new construction. And I like to say those are like gold. If you can get a 9% award, you know, you're good to go. And then there's also the 4% credits, which are for rehab. Just as an example, Kingsport recently undertook a 4% project in connection with a couple of National Housing Trust Fund awards and Tennessee Housing Trust Fund awards, and are rehabbing, you know, parts of their, what we would call their existing public housing portfolio. And that's about a $40 million project. When you combine the grants, the tax credits, and then some loans that'll be amortized from the rent. So that was a pretty big project that's actually ongoing right now. The funding's all been finalized. It's just the rehab work that's ongoing. You know, there's a lot of 9% credit properties in Sullivan County. That process has become more difficult for our area in the last couple of years because THDA has changed their scoring system. There may be a 9% credit property in Sullivan County in the last 2 to 3 years, but I'm not aware of it. And it's just based on need-based scoring, that a system that THDA develops, that if you don't have a high need score, because it is so competitive, you're probably not going to be successful on a grant. So usually there's a combination of, if you don't have a 9% award, then you're usually looking at a 4% tax credit combined with some other funding sources like a National Housing Trust Fund grant or city investment or other sources. And that would be for rehab only. And I'll stop there and ask if there's any questions about that program.
So does the 9%, is it either you don't get it or you get 9%, or do they score and give you a 5% or something different?
No, and 9% is definitely it's just a term. It's really a 9% credit that's awarded over 10 years. It, you know, roughly speaking, you then sell the credits to tax credit investors. And you can pay for 70% of your project, you know, through the sale of the credits. And then the other 30% is usually financed through some sort of construction mortgage and permanent financing. But so you usually don't need any other funding if you can get a 9% award. But again, that is new construction only. And usually those are rent restricted on something what they call the 60-40 test, which means, you know, 60% of the units have to be set aside for people with 40% of the area median income or less. So there's a couple of different tests you can elect, but that's the most common one.
Okay.
So when you talk about rehab, you know, and to Malin's point, you know, there are some other areas that have rehab their housing of this nature. And of course, the Bay lifts all ships. That immediately improves the housing values around those areas, as well as aesthetically, it gives a refreshed look to the overall community. So we have some of those areas near our downtown, as well as on out a little bit. So I think I would really be interested to learn more about what the process would be to rehab, what the actual cost to us as a community would be, you know, who would take that on. I just really don't know enough about that. And I think that's something that as we are looking at lifting the whole community, we would need to know more about the rehabbing that we have in place. Be very interested in that.
With the any tax credit structure requires a developer, because you know, there's a certain amount of risk involved, and requires a typically the property's transferred into an LLC or a limited partnership, and ownership changes, and the housing authority can remain involved as a property manager or some limited role like that. But in order to get the benefit of the credits, it means, you know, transfer of title to this new entity, and usually the involvement of some third parties.
So I would wonder, so I think, and council can correct me, but I think some of the areas that we think about are individual single family homes, some of them perhaps used as apartments, but they are owned by a variety of owners. So to make this work, it sounds like they all need to be, tell us about how that would work then, Joel.
Well, for single family home ownership, yeah, this is rental. This would have to be, you know, rental units under a single owner, or people that were willing to sell. I don't think it would be feasible to, you can gather single family homes and sort of group them together for a rehab project. But if you don't already have ownership, that's probably going to be cost prohibitive. You know, for families and properties that are already owned by individuals that need rehab, you know, I think you mentioned earlier, you know, rehab grants. I do think that is something that would be legal. THDA already has a program, you know, I think that gives grants directly to homeowners. You know, I know they have a down payment assistance program. I was involved in a project that used that pretty heavily about 8 years ago. And I believe they also have a rehab grant system or program. And certainly I think the housing authority could legally, as long as they qualified as low income, make grants for improvement purposes to individual homeowners. Now, obviously funding for that is always an issue, but theoretically, I think if you had the funds set aside for that, it could be done.
So what do we do about housing that is government owned that has not been rehabbed?
Well, if it's owned by the housing authority, then, you know, that might be something that could qualify as a 4% tax credit project, and grouped together. There could also be maybe a National Housing Trust Fund grant or some other program that could be used, or maybe oftentimes in my experience, it's almost a combination of multiple programs, because a single program usually isn't sufficient to, you know, do the level of rehab that needs to be done.
Steve, where are we with some of those opportunities in Bristol?
Well, I'm telemeeting with a consultant from KCDC, which is Knoxville's housing authority. And of course, they're huge, but their rehab specialist, we're meeting with him tomorrow. And of course, this has been postponed. We were supposed to do this back in February, but it's been postponed, obviously. But we're going to look at the repositioning, as HUD calls it, and RAD conversions is basically what would take place. One of the options that we've talked about, this housing authority does have a community development corporation. We've never used it. It was established with the state about a year before I came here, so I guess 22 years ago. And it's a nonprofit, which is totally separate from the housing authority itself. Like I said, we've never used it for any purpose, but it's there. So if we want to start doing this, but basically what would happen would be HUD would allow the transfer of ownership of whichever public housing units, whether it's one of the high rises or both high rises or all the scattered sites throughout the town. We would transfer ownership to the nonprofit corporation. And then at that point, we would be able to take out loans or partner with developers. Now, once you do that, there's no more public housing subsidy from HUD. There's no more capital fund subsidy from HUD, which I get about $625,000 a year. But like I told you guys in my last presentation, anytime we do a project at one of the high rises, it eats up $300,000 to $400,000 of that. So that's why I've had very little money to spend on the family units over the years. Plus, I know the curb appeal is not great with our units, but they're very sound construction wise. And we have to do very little to those units. And they've been used and abused for the last 50 some years. Most of them were built mid to late 60s, but they've held up extremely well. And as far as Bristol, Virginia and Kingsport, the rehab they've done, their units had become, mainly because part of it due to the age, being built in the late 30s, their units had become unlivable, to be honest with you. And so the rehabs were absolutely necessary. That's why they were able to demolish and rebuild. My understanding that even in the newer units, unfortunately, some of the tenants have torn them up. And HUD's great theory is that if you improve your properties, then your residents will take better pride and give more of a commitment to keeping those up and not damaging and that sort of thing. Unfortunately, that doesn't happen. It does in some cases with the elderly and disabled, but for your average resident, those units are taking a lot of abuse, and it's a shame. We do inspections for Bristol, Virginia housing on those units, and my inspector has come back and shown me pictures of the damages that have occurred. And I'm not trying to be negative, but yes, they look good. Does it always improve things besides curb appeal? Not necessarily. But anyway, I got off subject there. After I meet tomorrow, I'll know a little bit more about which direction we're going to go in. HUD has been pushing this conversion and repositioning pretty hard. What you do end up getting, however, are vouchers. So all of those units would become Section 8 and or Housing Choice Voucher as it's known right now. So the Housing Authority itself would be the middleman and funnel the Housing Choice Voucher money to the nonprofit. And that's how we would make the money and keep the units up. We would retain ownership basically, but it's a separate arm of the Housing Authority. It's the way that would work. But like I say, then you're allowed to go and borrow money and do your rehabs and brighten everything up. Does that make sense?
Yes. So with the Housing Authority, whenever anybody mentions borrowing money, all of our antennas go up and, so who is obligated for that borrowing?
The Housing Authority.
The Housing Authority.
Right. Or if we were to sell, let's say Fort Shelby to a developer, it would pretty much be the same way. Then we would channel the Housing Choice Voucher assistance to whoever the new owner is.
So this in essence works. The Housing Authority is the responsible party for all things related to it. with the falling under the umbrella of the city itself, but the housing authority acts independently of the city.
Correct. Now, I do know there have been some partnerships with, and especially like in Knoxville and the larger cities, to help with the funding. Go ahead.
This is Joel. If you involve tax credits, you have to create a new ownership entity, a limited partnership or an LLC to get the benefit of those credits. So title is actually transferred to that new entity, and usually the partnership has some sort of buyback or option to purchase at the end of the tax credit compliance period, where the housing authority can in essence buy the property back at a very low price, sometimes like $1. But to get the funding, sometimes the legal ownership does have to pass away from the housing authority, and that's only allowed if you go through the RAD conversion process that Steve just described.
Right. Okay.
And the loan would also be under the name of the partnership, but often guaranteed by the housing authority.
So that new LLC, it in this whole process, while it does retain the ownership of it, it acts more as a path that can then circle back around to the housing authority, if I understood that correctly.
Typically, yes, it's sort of a pass-through entity, as long as things are going well, I'll say. And the housing authority usually acts as a property manager. So they're still responsible for the maintenance and dealing with the, collecting the rent and dealing with the tenants and lease up and those sorts of things. And they, of course, get a fee for that.
So that partnership, it could be through a private developer, is what you're saying?
It has to be to a certain degree, because only for-profit banks or investors get the benefit of the tax credits.
Okay.
I have a question on the TIFs. You mentioned blight is, and I'm assuming there's not any such thing in housing as an economic TIF. Is that?
No, state law basically that was passed a few years ago said economic blight or economic underutilization is not grounds for a blight declaration. In other words, the theory that the property taxes could be higher is not reason to declare a district blighted.
The more important aspect, if I understand correctly, Joel, is that it is to provide quality housing for all income spectrums, or lack thereof.
I'm not sure.
It's not to.
I'm not sure I understand that question.
It's like you said, their impetus is not that we're all out to generate a higher revenue stream. It's to truly provide a better quality or a more updated quality of housing. For its
right, to eliminate the blight is in essence the purpose, which blight has a fairly broad definition, but it mostly has to do with the physical conditions of the improvements in the area. And if you've got a totally vacant piece of land, it's not going to qualify. But if you have dilapidated structures with code enforcement issues, those sorts of things, even to a certain degree, economic obsolescence, not economic obsolescence, but obsolescence of use, then it can qualify as well.
I wanted to be sure to add in that through our city community development program, that we do rehabs. A certain percentage of that CDBG budget goes for rehabilitation, and with that, and there's lots of different criteria for that. But there is a wait list all the time for those rehabs. That's not working with one owner for a large number. It's working with individual homeowners for getting their property brought up to code brought up to better quality. So,
well, I don't know, sometimes the CDBG money in regard to that, Margaret, and I think you've been involved, is that it's providing like ADA accessibility. It's not like what we think of as a total rehab. It is a rehab.
No. A lot of it is new roof. It is new flooring that has, I think a lot of it would be exactly what you're talking about, rehabilitation. There might be, yes, the ADA component, and maybe that gets more points and gets pushed ahead. But no, it covers exactly what we're talking about for substandard housing being improved. So.
Well, my point was that it doesn't have to be a total rehab. It can be a start based on need.
Right. But they do, there's rules on that too. It's up to a certain point, and if it's past a certain point, then it has to be torn down and rebuilt as opposed to investment in the rehab. But yeah, so that program is going and it works really hard, but wait lists, because there's only a limited number of people who are served every year.
So from this, what is council's expectation of this aspect moving forward?
What I was going to ask, Steve, it sounds like you're proceeding with trying to figure out our housing authority's position on the direction that HUD is putting out there. And that once that's a little bit better examined and determined, we had talked about a strategic planning process for housing, and we talked about doing it broader than just your what we know as public housing. So so in the next few months, are y'all in better position to look at putting together a more comprehensive plan?
Yes, and that's why I really, everything's just been at a standstill until we make a decision as to whether it would be best for this authority to stay as is or to convert through the repositioning. I did want to bring up in our original redevelopment plan for the city, which I know we've talked about, we need to update because it's now 25 years old. There are 2 study areas already established in the plan. They're not redevelopment districts, but it would be very easy to amend the plan and convert them to districts. And first one was the Hillside / Boer Road redevelopment area. And there's quite a bit of acreage up in there. And we felt like at the time that would be an area that had a lot of potential. It's close to King College, obviously. It's close to downtown. And we felt like also that it wouldn't be one of those neighborhoods where everybody would go, hey, not in my neighborhood. Mm-hmm. So, and of course, a lot of the new developments, just like Vice Mayor Luttrell brought out over Bristol, Virginia, a lot of people drive up through there and they don't think about public housing or the projects anymore. And a lot of that, that's very important to do that. I also think too, when you do these projects, if you can distance the housing authority away from them as much as possible, just because of the public stigma. When we were doing the TIF on Lavender Lane, for example, there were people down in that area that found out the housing authority was involved. So I had people beating on my door and saying, you're not going to build public housing in my neighborhood, blah, 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 blah. And it was hard to make those folks understand that this was going to be totally different. So I think that's one of the reasons when you do your nonprofit corporation that you name it something different and get away from this public housing stigma, because at that point too, it would no longer be public housing if we were able to build something. The other area that we have established is the original weed and seed area, which Margaret and I were very involved in that way back when. Basically Hill Street, Windsor Avenue, Wilson Avenue, I think. Were there a couple of more streets? I think maybe Anderson Street was involved in that as well. But there again, a lot of those homes up through there, they're cut up into apartments, but they're owned by so many different individuals that I don't know what we could really do up in that area, because I'm not aware of any vacant property. But I do think the Hillside Boer Road area is something we could definitely look at.
Yeah, and just a reminder that for that Weed and Seed Anderson Street neighborhood, we did pass new zoning, et cetera. So over time, the hope was that that would help to transition that neighborhood. So that would, with reduction of number of apartments in the old houses, et cetera. So we have done some things. So I guess what I think is really important, and I know we've talked a little bit about being sure that we understand directives, et cetera, but for this discussion, I feel like we've learned a little bit. We may need to learn a little bit more, but I think some of this discussion leans heavily on our housing authority's direction to come back and keep us updated for what you're learning and then the direction you think that you're going. In the meantime, if we want to go ahead and look at those study areas and see, the other thought is to go back to our volunteer parkway redevelopment that our folks presented to us and see if any of those areas either already fall in redevelopment or would they be appropriate to look at as redevelopment areas or study areas or whatever. And Joel, I don't know if you saw those are mixed use, and looking at areas right off Volunteer Parkway, how they could be developed into the mixed use income, mixed use commercial, et cetera, just like what you were referring to earlier. We were pretty excited with that plan. So maybe going back and seeing if are there things we can do with it to help move it forward. But that's kind of, I would think that we want to keep following our housing authority, see where that falls, that would make a difference. And obviously this is a piece into the comprehensive overall. And I guess just before letting other people talk, a couple of things overall is I think it would be great if we can come up with our comprehensive housing, what's our plan across our community, also what is our incentive plans and how are we putting that together to market it so everything's in one piece that people can understand. The other part of all this discussion that I really like is that if we can align with our region as much as possible, that or at least we agree on one of the basics, and then if there's a little bit of differing, but I think that concept of helping our development community across the region to not have to understand how it's different, not be able to kind of pit us against each other, but then by incentives we can provide our advantage, not by which codes we've adopted. Anyway, I like the idea of trying to do those things. So that's kind of where I fall, but I think that there's probably a few things and maybe we can make a list and get back out for immediate action to consider, or things on the calendar like the codes that we watch that and are going to look hard at the energy code part. But anyway, actions that we can take coming up that maybe not at the next meeting, or we need to put it all together.
What I would propose that we also take a look at, I think we've all shared some very similar thoughts, is that we have an end date of August that have a report at our monthly work sessions moving forward as to how this is all progressing, if there needs to be further conversation, education, clarification, but that we tentatively set date of completion for or of review. I mean, it could go longer, but August, Chad, your point that And Danielle's about the codes and what the state's going to do. That'll give them time to figure out what they're going to do or let us know. And Steve, to your point, you know, you'll have met with Knoxville by then and with the Housing Authority to give us some direction on that. And Joel, of course, with your counsel the whole way through, and Bill with your oversight. Then, you know, because we don't want this to languish. We want to be educated, we want to be informed, we want to make a decision, and we want to move forward.
I think
August.
Yeah, I think that's good. You can always change that deadline with unknowns like COVID virus stuff that stops everything in its tracks or whatever. But I think absolutely keeping stuff on the calendar so that we continue to track and put pieces together. I think that sounds reasonable to set that as a target.
Yeah, maybe if it's possible, if we could get that pulled together for our work session in August, that would be awesome. Or earlier, of course. I will be always the optimistic say to go earlier. But I just got a quick question. As a matter of fact, last week, Steve, you mentioned the Brewer Lane area. I saw a plat where, I mean, it's already sectioned off. It's got plans for utilities, infrastructure, roads, curbing, everything in that area. And, you know, that also extends into Virginia. So that was exactly what I was thinking about, was a great area. And I wanted to make sure I understood. So we talked about low and moderate income, and that threshold is right now around 55, in Sullivan County is around $55,000 a year. A family of four, I think, Danielle, correct me if I'm wrong, family of four, $55,000 worth of income, or kind of is that income threshold to stay below. My question is if you had a development like that, well, I tell you what, let me let you address the income thing first, Danielle.
It's a little lower. I think moderate is typically 80% of that median, and right now our median is about 55. So for a family of four, you're talking about, Christina gave me those numbers, and you're looking at maybe 47 would be the 80% mark for a 55 median income.
So does that qualify someone for a potential help, financial help, as a low income person, or is it classified as a low to moderate income person? Or does it matter?
I think for our purposes, you're really looking at that. Anything under that would be the moderate, and then the low is even lower. What we use is a HUD, at least, and I'm going by what CDBG uses for low and moderate, and I think that's probably, you know, Joel may have another metric that he wants to use, but
you could refer as a
HUD pretty much look at it. Huh?
You could use that as qualifying,
right?
Rather than, you know, the lower, the median, moderate. You know, I think they're calling out a qualifying resident.
Right, and I think they're going to qualify for a lot of help. They may qualify for CDBG aid if they're under that 80% of the median income.
So if you took, this is back to Steve and Joel, if we took that property as an example over in the Brewer Lane area, and I don't know how many house plots, I mean, how many places there were for houses, but it looked like hundreds. But if you took that area as an example, are you saying one way to really push that along would be to have a low to moderate income section of that, and then a market rate section of that for maybe housing up to, you know, I don't know, $300,000 range or something like that? Is that kind of what you're thinking there?
Well, if it's in a TIF district and it qualifies, you're not necessarily limited to moderate income, because your purpose is different, in that your purpose is to eliminate blight. Just like we can use TIF for commercial purposes, we could use it for, to my knowledge, to my understanding, any sort of residential purpose, including market rate apartments, market rate single family, market rate planned unit development. So you could incentivize, you know, a larger scope project in that district, and maybe also combine it with some sort of lower moderate income project as well, just to spur development, period.
So is the Brewer Lane area, Steve, that we mentioned, is that a blighted area?
Well, like Joel said, blight is a very broad term and can be used just about any way you want to. It's underutilized for sure. And my understanding on that thing was planned out in maybe the early 50s, and it was to be a nice subdivision when subdivisions were just getting started. And for whatever reason, it just never happened. And like you said, the plats, they've got everything laid out and planned out. Of course, that was back then. But I still think it's a great area to look at. Some of the things we had also talked about, though, if you did that and did a TIF, maybe try to get the walking and bike path established up to that area to make it more appealing for younger folks that want to live there, or even students, to get them downtown and encourage that. Because as you know, it's not ideal getting from there to downtown unless you drive. I did want to mention, I've got the latest statistics for the Tri-Cities Metro on the incomes. The current median is 59.1. To live in public housing, a family of 4 has to make 47.3 or less. Now for Housing Choice Voucher Program, now this is going to shock you. You have to make 29,550 or less for a family of 4 in order to get a voucher. And the problem with the repositioning, if we convert some of our properties from public housing to Section 8 vouchers, you see what's going to happen. Within 2 years, anybody that's above that 29,550, they're going to have to find another place to live. And for those that are on fixed income, Social Security, disability, that's going to be tough, especially like the folks at Fort Shelby.
What is the, you said $29,000 for a family of 4?
In order to get a voucher. That's considered very low.
What about,
go ahead.
Well, I was going to ask you, what about a single person, like a retired person or something like that?
For voucher or public housing?
For voucher.
For one person, 20,700. And then a percentage of our vouchers have to go to the extremely low income persons, which is currently for one person, 12,760. You got to make that or less to get a voucher. And I think now 75% of our vouchers have to go to the extremely low. HUD started that a couple of years ago, and that really made it tough on people to make the rents work with landlords. Because if there's not money for the landlords, that most of them are not interested.
So Steve, it sounds like for y'all to make decisions, I mean, there's a lot that goes into that.
Oh, yeah.
And I mean, that's a study in and of itself. So as y'all progress through that, it will be good to get some of that data to know what percentages, I mean, as you look at who falls in which category and who's going to be left behind, and how do we, how does that happen? Because just thinking with the data that y'all have in your thought process will help us to understand how you come to the conclusions you come to. So I think sharing that. Also, just for, I know this council really likes information, really likes analyticals and analysis. So I think as we get into this, that it may mean some, like that August work session may need to be a separate work session, because we've also got traditional things that we do in August, et cetera, et cetera. So Anyway, and also, Steve, if there's opportunity for us to either officially meet with your housing or invite us to a meeting where you're having a report on something or presentation, I think that would also be a way for us to be better informed and understanding of how things are going.
Sure, we can do that.
So. Okay, so August is kind of our date that we'll try to look for, seeing what, and possibly a few things before that, if we need to be actively doing anything I mean, we'll be looking at the state for our energy codes, but whether there is opportunity to start looking at that redevelopment plan, do we need to be looking at it? If so, what would a timeline be, and what are the opportunities to do that as well? If we're okay, anybody else have any other questions for Steve or Joel while we have them both here? We thank y'all very, very much for being here. We love your expertise and ability to share information with us. So, and
thank you.
Hope to be a better partner with, or hopefully we can partner with our housing on this and other opportunities, and looking how we can serve all our citizens in our community. Mr. Soar, do you have, well, before you start, I'll bring up, and Joel, if you need to leave, you're welcome to head out. So we had an appointment that came in late for our council meeting last week, and that is for the Sullivan County Board of Equalization. I think their schedule is they try to do orientation in June for that position. We had one applicant. Normally we would, I think Bill sent us information. Normally we have, we wait and do June appointments in July. And we did that to allow, particularly to allow new people who are elected to participate in those appointments when they come into office. This is not an election year, but I like that habit. I think keeping it standard is okay. But a question is if we would be okay to put that appointment, which was actually a May appointment, on our agenda for June, so that we can get that position filled and keep with the Sullivan County schedule. So is council, how do y'all feel? Is that okay to put it on the June agenda?
Okay with me.
I'm good.
Vince, you okay?
Yes.
There you go. Okay, so Mr. Soar, if you can add that to our June agenda, we would appreciate that.
I missed it. What are we adding?
David Warren's appointment to our June agenda. So, which is sort of differing from our habits, but not really, because it's a May appointment. So anyway, okay, Mr. Sora.
Actually, we need to go back and pick up an agenda item.
Sorry. Oh, I'm sorry. Yes.
However, it's 11:22. We've been at this now about 2.5. We've got, as Chad would say, the lightning round to go. If you would like, we can reschedule Danielle's discussion of the tap fees on our meeting on the 19th, or we can go ahead and stay. What's the pleasure of council?
Let's put it on the 19th, and we'll get to read through it more, and because I know Danielle spent a lot of time in it, and everything she does is done well. So let's do it on the 19th. So we've got our full attention.
Everybody okay with that?
Yes.
Okay.
Yes.
All right, then I would remind you, then we do have the meeting at 9 o'clock on the 19th. So we'll add this to the agenda. We also will have our Department of Health officials invited back, and they have already confirmed their attendance. Also, at that work session, Scott Gibson will join us electronically, and he will talk to you about the refunding of a 2013 Series A bond. This was the initial tranche of funding for the Pinnacle. It is an opportunity. We have that window now to do a refunding, and the interest rates are such that it's advantageous to do that. The ballpark numbers in terms of savings over the life of that loan will be about $1 billion. This will not change the amortization schedule at all, but he'll be here as our financial advisor to detail that issue. And then also Sheriff, and then a member of the Netter community will be here. Sheriff will provide the housing study, and this will be an updated version of what was presented 2.5 years ago now. We'll also have a member of the Netter community here. I think that's good for them to give kind of a different perspective from the real estate market as to where we are and what the needs of our community would be from their perspective. Then on May 26th, we'll have our budget work session. This will also start at 9. One of the things we've talked about in terms of that's the meeting that we would like to be able to come together with multiple screens. And all of you have been in one of our budget discussions before. We generally have multiple screens going. It's a little hard in a Zoom format to do that. So we had talked about the Nature Center, but one of the things that Terry Napier suggested is that perhaps we want to use Slater Center. We can use the cafeteria for a presentation. We'll need an overflow room. We want to be able to practice our social distancing and keep our groups within one area to 10 or less to be consistent with our phase 1 criteria. So with that, we can utilize the cafeteria. We can utilize the gym. We can also utilize classroom space to do that. But that's a suggestion that we move that from our Nature Center to Slater Center.
I've reached out to Bill yesterday. I have a conflict on the 26th out of town. And I asked him if it would be possible for us to if council was in agreement. And if y'all aren't, I understand. If we could move that to the first week of June, like June 1st, that Monday before we meet on June 2nd. Bill didn't give me any exact dates, but he said the first week of June would be better. I know, Chad, you're going out of town somewhere in there. Would that be a possibility? It would just really help me in this particular situation.
Would it be better to do it sooner? Like,
Chad, we can't. We're fighting to get that budget put to bed by the 26th. So we couldn't move it up.
I'm good with June 1st. Let me check.
I have a conflict the morning of the 1st. I can meet the afternoon and stay as long as we need to that evening, but I can't do it on the morning of the 1st. The rest of the week, I'm wide open.
I'm fine with late in the afternoon. Would be fine with me.
Either way, I'm good.
Do you think we can get it all in, Bill, going at it the afternoon of the 1st, or should we with the 2nd and we just take the
2nd would be fine. The 2nd would be
the
fine.
day of the 2nd, we've got our council meeting that evening. I mean,
are we saying we're going to meet live for our council meeting?
That's the desire at this point.
So we're talking about two things. One, yes, meet live for a work session. At this point, June 2nd council meeting, we could do a Zoom. We still have permission to meet electronically through the end of June. And I guess part of that could be looking at numbers and also preferences of council for how, and also advice from attorney, and as y'all are strategizing how we keep that social distancing and not knowing how soon things are going to open up. Certainly in our auditorium, we'd need to spread us out a little bit, but we would, for a normal attendance, we can social distance, and if that number has gone up with phase 2, we can do it. But anyway, just go ahead, Chad.
That week is a difficult week for me, but I do see where we need to, have our budget meeting, all together. And I think we're talking about having maybe us 5 and 2 others, 3 others, maybe 7 or 8 folks. And I think that's good. I would love to see us go ahead and plan our council, and I'd like to do that on June 1st, after the June 1st, or as soon as possible, June 1st. I would love to see us have our council meeting by the same format so that we can plan for, unless there's let me say this, let me ask this question. Is it imperative for us to have our council meeting on the 2nd live, or could that be done by Zoom? My thought is we've had more attendance and folks listening from the comfort of their own home. I'm sure they can do that either way, but is there a possibility of going ahead and planning that forward for all planning purposes? Let me say that, to do a Zoom for our council meeting on June 2nd.
I do have one thought on that, and that is you are permitted to do the Zoom or the electronic format as long as there's a finding by council that there's a need for it to preserve public health, safety, and welfare. And I guess if we are going to meet in person and we're going to be able to have the public watch it somehow, for the budget meeting, then will you be able to make that finding for the city council meeting later that night?
Well, I think for the public, we could. For the meeting, could we not?
Well, I think that's really a question for you guys, because depending on how the format of the budget meeting is, if you can replicate the same format for the evening meeting, then that's the question: is would you not do that, or what's the public health reason for meeting by Zoom format after? And I guess those are questions that you guys will need to think through as you go into that.
Well, we're talking about having in our budget meeting on Monday, June 1st. It'll be Monday, June 1st, the afternoon of. Bill, you want to say something? Go ahead.
I think we landed, and correct me if I'm wrong, I think we landed on the morning of Tuesday, June 2nd for our budget work session. That was my takeaway. If that's different, we had talked about the afternoon the 1st, which is fine. I just would like some clarification, because we will need to do the advertising.
Well, Chad, what do you think? Do you think we can get it all done in the afternoon on Monday? We've usually taken a full day to do this, and I feel bad in asking because I'm the one that's thrown the wrench in, but would we be better off to take the afternoon of Monday and then have our meeting on Tuesday night, or take the full day have the option of the full day on Tuesday, should we need?
I would rather do it on June 1st, afternoon of June 1st, if we can. The reason that the difference for me is we've got a very limited few that would be meeting for our budget meeting. If it needs to be live broadcast, that's fine through whatever format we need. On June 2nd, we usually have a larger crowd. And if someone does not feel comfortable in coming and making public comment, they can do that through the Zoom format. They cannot do that, however, unless they're in person at our council meeting. That was the only thing that I was thinking on June 2nd. And again, you've got an out-of-town conflict. I've got an out-of-town conflict that week, the first week of June. Right. So my thought is if we could do the budget meeting the afternoon of June 1st, and then Zoom our council meeting on the 2nd, is what I was hoping for. But I'm open to. I'll change my travel plans if I need to.
I want you to have to do that.
I'm good with that.
Yeah, I think that has merit for what you said, and I think the budget meeting will not be. Usually, our workshops are not live streamed, but I think our staff is working on where if there are public people there and that goes over our number, that's where there'll be a screen or whatever in the gymnasium or other location, and also for our staff, and then they can be called in when they're needed, but they've followed where we are so they know what's happening. So anyway, I think Bill's nodding his head that that's what the plan is for. So Bill, what time can you start on June?
1 o'clock. 1 o'clock.
Okay. And we can have snacks or be prepared to have supper if we need it. So I think we've usually gone like from, I think we start at 10 o'clock frequently and go till 3:30 or something like that. So anyway, yeah. So
you guys are okay if we do that June 1st, afternoon of June 1st, and then Zoom on June 2nd?
I think that,
council meeting.
yeah, I think that's okay. Is everybody good with
You've
that?
made a great point about the Zoom, about it's not so much about us, it's more about the community and the comfort level of people attending or calling in. I think that's a great point, because I think, you know, as we try to work back towards the normalcy of life, you know, psychologically, I think a lot of people are struggling about getting out in the community. So I think that's a very valid point. I hadn't thought about that.
I had a neighborhood meeting last night, and there is a lot of apprehension. And I mean, everybody had masks on. I'll also say this too, that I've seen both circumstances, but I went into a convenience store for the first time in about 2 months, walked into the convenience store hoping to grab a biscuit, and every single person, with the exception of one person in that convenience store, had a mask on. And I bet there was probably a good 10 customers in there and 3 people working behind the desk. So I think it depends on the venue and the tightness of quarters. Sometimes I've gone into, you know, one of the a Lowe's or a Home Depot, let's say. I was going to try to, but anyway, you know, you go in there and you're outdoors, and the spacing's pretty good, and you know, you don't see as many people, you know, with the masks on. And in this day and time, a lot of folks are at home, so they're trying to get their flowers planted and things of that nature. But well, that would be great. I think it gives our community a heads up of what our plan is for those public meetings as well. So that would be great, and I can make plans accordingly as well.
And Bill, can you tell us what also that we need to expect for so first reading, we would hope could be June 2nd, which also gives y'all time to prepare for that after our work session. And then second reading, if you can give us what that schedule might look at like in June.
We can do second reading the following Tuesday. There needs to be 7 days between first and second reading of our budget ordinance. That meeting does have a public hearing element to it at the second reading, but we can have that on the 2nd. We can have it again on the 9th as for second reading.
So can I ask one question that pertains to our budget meeting? When do we expect to have retail numbers in from, let me ask this, will we have retail numbers in by our budget meeting June 1st from what sales were during the month of April?
No, we will have them for March. Generally, you have a 6-week lag time. So somewhere between the 15th and 20th of this month, we should be able to get the sales tax numbers for the month of March. For April, you'll be at that same timeline in June. So 15th to 20th of June. So the budget would already be passed by that time. But yeah, and that's the tough time with the timing of this virus and how it hit our economy. It makes it very tough to predict for the budget. I guess on the positive side, this didn't hit at Christmas. And
let me say this: we rode out. Rush and I rode out on Saturday afternoon, a little bit late in the day, to the Pinnacle, as we do every now and then. And it was pretty brisk. There were a lot of people out, saw a lot of bags. The restaurants were as full as they could be. I know downtown, the restaurants, the takeout, the reservations. And so, you know, we're not firing on all cylinders, but the car's still running and there's gas in the tank. And I think that I'm very encouraged. I'm very optimistic. I know we've got some rough roads to hoe, but I'm not willing to just start gnashing my teeth and crying tears yet. I think we are still in a very positive position, and a lot of that is because of the work that was done prior to our ending up with this COVID. But I'm very hopeful. Now, are we going to have to walk in place for a while to let it all come back? We may. But there are people everywhere that are in as the same shape we are or worse. And so, I want us to move forward as quickly as we can. And I think that people are out there and they're ready to work with us. That's all I say.
So a couple of things. Mr. Sora, if you could get in writing to us the dates and suggested dates for the second reading and June work session, anyway, get those. And as we get those, we have next week to finalize, presumably, what those are. So if you have conflicts or whatever, you can let folks know, but we can talk about it at that meeting to talk about that schedule and finalize if that's okay. Also, as we're getting ready to add anything else in, Terry Napier, if you're still there, if you can tell us about the mask distribution, that'd be great. And if he's not at his desk, Mr. Sora, I think those are this afternoon. There he is.
He's with us.
He disappeared. He was over on one side of the screen. Now he's on the other. There you are.
I get booted a lot. I can't help it.
There you go.
So yeah, we'll be doing our second mass disbursement this afternoon, same location, Idlestone Jones Tennis Courts. We'll be starting at 3, and we'll run it till 7. That way we get people, that are working after work. So good mix. And then I'm assuming that we'll have masks left over or get more masks this week. So we'll probably do another one Saturday. We're tentatively looking at some times now.
Yeah, and I think we need to touch base back with our health department and be sure that some of the places they talked about distributing, that we have those, that those are in our community as well, with our feeding sites, et cetera, the things that were discussed. So if you or Mr. Sora or whatever can check back and just be sure that that's happening. From what it sounds like, we're going to have a large number of masks over the next several weeks. So we want to get those out to our citizens in every single way possible. So
absolutely,
which also makes a statement and encourages everybody that this is important. It's hugely important. It's what our state government, Governor Lee, has decided to prioritize for how to spend those federal dollars coming in. So we really want to support that effort and also move us forward so that we don't stir up more infection. Okay, anybody else have comments?
Yes. Oh, wrong sign. I'm sorry. Hang on one second. I just wanted to let you know today at 1:30, we are going to be having a telephone conference to discuss, and I have not given up on this, about the autonomous shuttle. And I'll just put it real close right there so you guys can see. But at any rate, 1:30, if you'd like to attend, some of the key people that I think will be, I know Bill is committed to, I hope you still are able, your time allows to do that at 1:30. April, I think, has said she's going to do it. I think a key person is Terry Napier, and hoping that John Luttrell will, as well as Tom Anderson, can be in there. If you guys would like for me to forward you the number to call in and listen, but in essence, it's where they might bring this shuttle to demonstrate for us how it would work, within our city, within our community, well, let me say this, during the time of Rhythm Roots and Bristol Motor Speedway's event coming up in September, all of that is contingent upon how things open up and, where we are with the COVID So if you'd like to listen, and Vince, I think it'd be great for you to listen if you could, if you got time to listen in on it and just see what they have to say. They're pretty interested in us because we do have a large number of folks that come in town during that time period, for both events. So.
And hopefully they'll talk about funding also. For how
the event we're hoping won't cost anything, and it would be an educational type thing for autonomous shuttles as well as electric vehicles in general.
Okay.
It actually covers a multitude of things, so it'd be a good educational thing for us, if nothing else. But yes, right. Exactly. The funding of it would be, if we were to go forward with something like this, funding, how we would structure the funding.
Great. Okay. Anybody else?
Hey, just go ahead and send that number out, Chad. If you would.
Send it to everybody.
Okay, we'll do.
Okay.
Anybody? Thank you.
Okay. The only thing I was going to say was, again, about Governor's Task Force, the Tennessee Pledge. A lot of really good work has gone into trying to provide guidelines and guidance, and that's been something talked about at all levels, is that folks want guidance, they need guidance. And I would encourage all of us to be sure people remember some of the basics. Have had interaction with a neighbor who didn't realize some of the different basics, and she reads the newspaper and is fairly well informed. And also for the Tennessee Pledge, our Region Ahead group on that website, regionahead.com, they have opportunity for you to add your business. If you are open, there's an interactive map that you can put your information and indicate you have signed the pledge, and then your location goes on that map. So then some of the folks who are reluctant, who want to support businesses who are following the guidelines and are committed to that, can find those businesses online and feel better with supporting those businesses and visiting those. So I think it's a great opportunity. It's great for those Region Ahead folks to put together an interactive map. So okay, and I guess Bristol's in the news a lot with our unique situation, so we'll continue to follow different times that reporters are looking at how we operate in 2 different states with different guidelines coming down from the top. With that, we'll call our meeting adjourned, and we'll be back together again next Tuesday at 9 a.m. as well. So thank y'all very much. Thanks staff for being here. Thanks IT for putting us together. Appreciate y'all.